Good afternoon. Today, St. Louis County joined Jackson County in appealing the Cole County ruling that led to widespread confusion and, if allowed to stand, will gut public health departments and endanger the lives of thousands. The confusion has already led to some county public health departments abandoning their response to rising COVID cases out of fear that the wrath of the state will descend upon them. The Attorney General chose to not step up and appeal the Cole County case, ignoring his sworn duty to protect all the residents. Instead, he is playing to an anti-vax crowd that he believes will help get him into a higher office. The action in Cole County was wholly inappropriate, undermining the mission of public health, which is to help those who are most vulnerable, the poor, the uninsured, and the underinsured, those without access to a primary care physician, those who have been hit the hardest by the pandemic. Pulling away the safety net of thousands of Missourians is beyond the pale, and that's why we continue the fight. St. Louis County wants what is best for our residents. As a doctor, it's the ethical thing to do. As a physician and leader of the county, it's the right thing to do. I often imagine what this pandemic would look like if misinformation had not been spread so widely and so loudly. Instead of a patchwork of responses across the country last year, we could have had a uniform response based on the science that was clearly showing the danger of this virus. We could be a much safer community. As we reported before the holiday break, St. Louis County has experienced its biggest surge in COVID-19 cases in more than a year, with more than 1,000 new cases reported on Thursday. Not since November of 2020 have we seen such numbers. The latest numbers released today show about 661 people are being diagnosed per day based on a rolling 7-day average. That's almost a 70% increase compared to the weekly average before. Our very high test positivity rate means that many people are infected but haven't gotten tested. And this is risky for all of us because people who don't know they are infected are likely not isolating themselves, so chances are high that they're in a public setting infecting others. The Department of Social Services at the state has confirmed that there are cases of the Omicron variant in St. Louis County. Omicron is likely 3 to 5 times more transmissible than Delta, so every infected person is infecting more people than ever before. Cases are likely to continue increasing. This means that you're very likely to be exposed to COVID-19 in the next couple of weeks if you're around others. You should take care to protect yourself with every tool available to you. While there's a lot we don't know, it's important to focus on what we do know. Vaccinated and boosted individuals have much less severe disease. Masking, social distancing, ventilation, and hand hygiene work to prevent transmission. And if you're feeling any symptoms, you should isolate from others until you can get a test. Hospitalizations are also rising, and staffed hospital beds are filling up. This is more stress on the healthcare system, and it's dangerous for all of us. We all rely on these services, whether that's severe COVID-19, a car accident, or a heart attack. Taking precautions to prevent or slow transmission can preserve the capacity of hospitals to treat sick or injured people in any of these situations. If you experience any symptoms commonly associated with COVID-19, including a cough, headache, sore throat, or flu-like symptoms, get tested. DPH testing sites are currently experiencing high volumes, so appointments are necessary. To make an appointment, visit revivestl.com. And if you've not been vaccinated, there are several locations throughout the county to receive one. They are safe, free, and effective. Thank you, and I'd be happy to take any questions.
Yeah. Any expectation of when you might see the action of the appeal in the Cole County case?
No, we just filed it today, so we'll follow the briefing schedule that the judge will publish, and we'll keep you posted.
And with the rising cases with Omicron detected in the county, are there any measures that the county is considering right now in response, as far as mask mandate goes, or any kind of
Well, the
ceiling?
Yeah, so the question is what measures is the county considering in the presence of dramatically rising cases of COVID due to the Omicron variant? Well, we're going to go to court and fight for our ability to issue public health orders. And currently that's tied up in the Cole County judge's ruling. The other pathway to public health response, such as stronger orders around masking, depends on the position of the county council. And currently, they haven't moved on the mask mandate request that's in front of them. In the meantime, everyone in St. Louis County should take precautions, should get vaccinated, and if you're eligible, get a booster, and should wear a mask, especially in public settings when you can't socially distance. We know that this virus is much more transmissible.
What are you hearing from the task force, the pandemic task force, in terms of their expectations for any kind of COVID increase after the holidays, and also their ability to handle another surge? What are they telling you there?
So the question is what's happening at the pandemic task force, and I would encourage you to talk to them directly. But what I've heard from them is that they are alarmed at the rising number of COVID cases in our community. They're alarmed at the rising number of hospitalizations. We do know that this variant, the Omicron variant, is much more transmissible. Early data shows that perhaps people won't get quite as sick, and we know that the current state of vaccinations helps us some in how sick people get from Omicron. But the transmissibility of it is worrisome, and as Dr. Fauci said, we have a virus that is much, much more transmissible, and if less people are sick, it can still add up to a whole lot of activity and stress on our hospitals, perhaps more than they can handle.
I did just talk to CMO who says that he has a little optimism that the high rate of transmission, and the fact that it may not lead to as many hospitalizations and deaths could actually get us over that threshold that we need to reach, like a herd immunity, that we could get enough antibodies into enough people that any future variants would maybe not have as much of an impact. Do you share that optimism, or where do you stand on that?
So the question is our path to herd immunity, and what's that look like with the Omicron variant? And I would turn to our public health experts and ask for their interpretation. I would turn to the pandemic task force. We do know that folks can get really sick from the Omicron variant. Folks can die from the Omicron variant, especially people that are unvaccinated or that are immunocompromised. And I would just encourage people to protect themselves and to get vaccinated. We do hope that there's another side of this pandemic. We do hope we can get there. I think that pathway is, in a large part, going to be through vaccinations. But I do hope that Omicron does not cause as much loss of life and long-term sickness in the community that we've seen in the past. But I think it's too early to tell.
There still continues to be a lot of questions about where people can get tested.
Mm-hmm.
How are you guys at the public health department? How are you dealing with those numbers and that interest?
Yeah, so the question is about testing, and that's always a risk. We know that we still have a lot of Delta in the community, and whenever your health system is overwhelmed by any illness, it can stress its capacity, and we're seeing some of that stress on the capacity of the health system now with testing. Our Department of Public Health testing sites are up and running. There are many other testing sites in the community. For the St. Louis County Department of Public Health, if you want to get a test, you have to make an appointment because demand is so high, and you can make an appointment through revivestl.com.
How many cases of the Omicron variant in number have been detected in the county, and what portion of the testing that's being done is being sequenced to check whether it's Omicron or a different variant?
So the question is about sequencing to track Omicron. That's done through the state, and there's a significant delay associated with that. We have 3 cases identified in the county. Our public health experts tell us that there are hundreds more. Just statistically, there's just no way that we could be going up this quickly and not have a significant amount of the Omicron variant in our community. But the sequencing, the DNA sequencing, and subtyping of COVID takes a while, and not every test gets typed, and that's a challenge that we've had since the beginning.
As far as a mask mandate that the council could vote through legislation, a lot of that's come down to politics. What kind of conversations have you had with the council chair about enacting a mandate through legislation?
Yeah, I think it's very important that elected leaders speak for themselves on questions of policy. We've talked about this, and at this point, council chair is not ready to move forward with the mask mandate. I don't know if that will change. It could change depending on what's happening in the community. But in order to understand her opinion, I think you should ask her directly. I think that's the fair thing to do. We do know that mask mandate makes a difference. We do know that as this gets worse in the community, more people will put on a mask. As more people get sick, as this starts to take an increasing toll. We also know that masks work, and that communities that have a higher mask usage see less spread of COVID, especially this variant.
To ask about a different subject, can you provide an update on the RAM settlement negotiations and whether the county and city and RSA have reached an agreement?
The question is about the Rams settlement, and at this time I don't have an update for you. There's no news yet.
Do you have an expectation of when the negotiations may conclude?
They could take a while. We'll talk about it next week after the holiday. There's no rush. The money's been moved to a trust account. And we all have a lot of things going on. We want to put that money to work in the community, but we also have some time to talk about it.
Dr. Page, I have one question from Public Radio about the letter you received today from the Federal Transit Administration saying that if the loop trolley does not start running again by mid-February, they may pull back millions of dollars in grant funds. Could you respond to that?
Yes, so the question is about the loop trolley and a communication or a letter we received from the Federal Transit Administration recognizing that the St. Louis region has not kept its commitment to run the trolley, which was required in order to receive those funds. At risk is around $37 million of federal funding that's come to the area, and this is a demand letter to produce a plan to get the trolley running again, or they'll begin the clawback procedures on that $37 million. The Loop Trolley Transportation Development District elected a new chair at their last meeting. That's Mayor Jones, and she'll be reviewing the budget of the Trolley Transportation Development District, and will present a plan to the board for consideration. It's unfortunate that East West Gateway Council of Governments at their most recent meeting refused another federal grant that would have helped get the trolley running again. That was unfortunately short-sighted and has put our region at risk to have this money clawed back, which is a black eye for all of us. And if this money is clawed back, then that will weigh against us with future requests for federal transportation money. Okay, thank you.